When the U.S. approves a COVID-19 vaccine, millions of doses will need to be transported and distributed across the country in stages. It'll be a huge effort, likely the biggest vaccine distribution effort in U.S. history. To do the job, the White House has contracted a company called McKesson Corporation. In August, the Department of Health and Human Services (HHS) stated McKesson Corporation's role in documents outlining the White House's vaccine distribution strategy. This isn't McKesson Corporation's first vaccine distribution rodeo. The company, founded 187 years ago and the seventh largest U.S. company in terms of revenue in 2019, was also responsible for managing the distribution of the H1N1 vaccine to as many as 90,000 sites across the U.S. during the 2009 swine flu outbreak. At the time, it was the biggest public health initiative in the history of the Centers for Disease Control and Prevention. The company has also had an existing contract with the CDC to distribute children's vaccines since 2016, and its role in distributing vaccines during the pandemic is based on that contract. Its success during the H1N1 epidemic bodes well for COVID-19 rollout, but U.S. public health infrastructure may continue to pose problems. As I wrote previously, the specifics of how a vaccine will be distributed by McKesson, and who will get it first, are not yet clear. In an email to the Medium Coronavirus blog, Robert Redfield, Ph.D., director of the CDC, said, "Through the Advisory Committee on Immunization Practices, CDC will play a vital role in deciding, based on input from experts and stakeholders, how initial, limited vaccine doses will be allocated and distributed while reliably producing more than 100 million doses by January 2021. McKesson shared its public statement about its CDC partnership with the blog but did not answer questions. There does seem to be a plan to determine where exactly McKesson will distribute vaccines, according to the HHS. A spokesperson for the agency tells the blog that ensuring easy access for all Americans, notably minority communities and medically underserved populations, is a top priority. Whether it's at a doctor's office, retail pharmacy, federally qualified health center, or hospital, they said, thousands of outlets will be available so no American must travel far to be vaccinated. The plan is that McKesson will deliver a specific amount of vaccine to a designated location once it's allocated to a given jurisdiction or authorized partner. In many instances, says the spokesperson, these will be sites where the vaccine will actually be administered. In others, McKesson will deliver vaccines to sites where health departments will pick up the vaccine and further distribute it within their networks. National retail pharmacies will also use a similar system. This system, says the spokesperson, will be scalable to meet demand. Until more is known about the vaccine to be distributed, it's not clear how it will be transported. Some vaccines are more delicate than others, and sometimes they require refrigeration. According to HHS, if the vaccine has ultra-cold storage requirements, it may be shipped directly from the manufacturer to administration sites, but this too will be managed within McKesson's centralized system. The contract the company has with the CDC covers the transportation of both refrigerated 2 to 8 Celsius and frozen -20 C vaccines. If the COVID-19 vaccine is not made in the U.S., distribution could be a little murky, depending on where the vaccine is actually made. The HHS spokesperson says the U.S. government is committed to working with other countries friendly to our national security to ensure safe and effective COVID-19 vaccines are developed as fast as possible. However, the vaccine and therapeutic candidates Operation Warp Speed has invested in are the candidates OWS believes to be the most promising, and all of those candidates are being manufactured in the U.S. McKesson's performance during the H1N1 epidemic in 2009 bodes well for the COVID-19 pandemic. During that time, it distributed almost 81 million H1N1 vaccine doses to 90,000 sites. However, notes journalist Michelle Cohen-Merrill in the medical publication Medscape this week, distribution ran into obstacles at the public health level. Public health officials struggled with the mechanics of designating priority groups and reaching out to them for vaccination while asking others to wait. I'm not sure there's much difference between 1976, 2009, and 2020-2021, Rebecca Wirtz, MD, MPH, of the University of Minnesota School of Public Health in Minneapolis, told Medscape. The issues around organizing a massive distribution of a new vaccine are pretty similar. The U.S. can't afford to make administrative errors during the COVID-19 pandemic, especially as the fall surge continues and the death toll mounts. States ultimately shape the actual vaccination programs, notes Merrill in Medscape, and it's up to them to decide who can administer the vaccine, and where. The hope is that state governments authorize as many people as possible to safely administer the vaccine and make access to it widespread and equitable. Neighborhood pharmacies will likely play a key role, as the HHS spokesperson suggests. For example, during H1N1, once vaccines became widely available, pharmacies played an important role in the vaccine distribution, they said, adding that pharmacies' role is even more critical to vaccinations today and will be fully integrated into the distribution plan.